Assalamualaikum everyone. This is Dr. Abdurrafi here. Today in this video we will talk about pulpitis and its response to pulp vitality test. Okay. Before that we have to know that what is pulpitis. Basically, in general terms, in the most simpler terms, what is pulpitis? Pulpitis is the inflammation of your dental pulp. Okay, there can be various causes which can lead to pulpitis, but before that, the pain of pulpitis cannot be located easily. Patient cannot identify which tooth is hurting or is painful in pulpitis, whether it's a molar or a premolar. Okay, firstly. Secondly, this pain can be radiating towards the jaw, radiating towards the ear, radiating towards the neck. Okay, so now what we know is pulpitis is the inflammation of the pulp. Okay, and there can be various causes and the pain cannot be located. Why the pain of pulpitis cannot be located? The question is this. The answer is the pulp, the dental pulp does not have proprioceptive receptors, whereas your pedial fibers do have the proprioceptive receptors. So what we conclude here is pulpitis and periodontitis or any periodontal pain can be distinguished from each other. How? That the pain of pedial fibers can be located by a patient. Now, as we have talked about that pulpitis and its pain is not localized, so there can be many causes which can lead to pulpitis. Now, we will talk about the causes or etiology of pulpitis. Number one, the most major and most common cause of pulpitis is dental caries. Okay, this can be your MCQ or BCQ too. This comes in exam. Secondly, abrasion, attrition, and traumatic injuries like cracks, fracture can lead to pulpitis as well. Why? Because all of these pathologies can make a bacteria to get his way through the dental pulp. Now, once a bacteria reach your dental pulp, there will be an inflammation. Okay, it will lead to pulpitis. Now, other than that, there can be chemical causes as well. Any irritant which can induce inflammation to the pulp. Other than that, there can be thermal causes as well. Now, when you are preparing a cavity, the frictional heat produced by your burrs can lead to pulpitis. So these can be possible and major causes which can lead to pulpitis. Other than that, root caries, recurrent caries, periodontal disease also can lead to pulpitis. So now, as we have talked about the causes of pulpitis, we will move on to the types of pulpitis. Pulpitis can be acute and chronic, and in acute division, pulpitis can be of two major types: the reversible pulpitis and irreversible pulpitis. And if both remain untreated, can lead to pulp necrosis, and your pulp will be dying soon. Now, how can you diagnose a pulpitis? There can be various factors which can lead to the diagnosis of the pulpitis. Number one, age of the patient. Number two, size of the carious lesion. Number three, presence or absence of symptoms. Number four, radiographs. Number five, pulp vitality test. And lastly, a direct observation of a clinician during a procedure. Okay. So these are the 5 to 6 factors which can lead to the diagnosis of pulpitis, but we will specifically talk about pulp vitality test, that how reversible and irreversible pulpitis reacts to pulp vitality test. So firstly we will talk about normal and healthy pulp. That normal, healthy or uninflamed pulp, how it reacts to pulp vitality test, or in simpler terms to the hot and cold stimulus. Okay, first of all, your normal pulp is symptom free, pain free, and it reacts normally to your pulp vitality test, and there will be no radiographic signs of pathosis in an unflamed healthy dental pulp. Okay, now if you apply a hot or heat stimulus on a normal and healthy dental pulp, number one reaction of a pulp will be that the initial response is delayed. Okay, firstly the initial response is delayed. You will not feel a stimulus or a pain immediately. The response will be delayed. Secondly, the intensity of pain will increase with the rise in temperature. So pain will be directly proportional to the rise in temperature. Okay, two things. First, initial response will be delayed after applying a hot stimulus to a normal, healthy, uninflamed pulp. Secondly, the pain intensity will increase as the temperature increases or rises up. Okay. Now, in contrast, when you apply a cold stimulus to a healthy pulp, you will get an immediate response. In hot stimulus, you got the delayed response. In cold stimulus, you will get the immediate response. Immediate response means immediate sense of pain, immediate sense of sensation, sensitivity or coldness. Okay, then what happens is, if you maintain cold stimulus for long enough, your pain intensity will start to decrease. In hot stimulus, as long as you are rising the temperature, as long as you are maintaining the temperature, the pain will increase. But in cold stimulus, as long as you are maintaining the cold stimulus, your pain will start to decrease. This is how your normal pulp reacts to pulp vitality test or hot and cold stimulus. The question arises, why the pain is decreasing if you are maintaining a cold stimulus? The answer is, your pulp vessels starts to contract when you apply something cold. Okay, so this decreases the intensity of pain. When you get bruises somewhere in the body, here you apply, or spontaneous bleeding or something, you apply an ice there, ice packs. So the same physiology goes for your dental pulp. Now we will talk about irreversible pulpitis and how it responds to hot and cold stimulus. Okay, so the diagnosis of reversible pulpitis will be made as when you apply hot or any cold stimulus to the dental pulp which is inflamed, you will get a sharp transient pain. Okay, remember these two words, sharp and transient pain. Okay, this will come in your MCQ as well. Sharp transient pain of short duration. The pain of reversible pulpitis will be of short durations in seconds, 10 seconds, 15 seconds, 30 seconds. As long as it goes to 59 seconds, it will be diagnosed as reversible pulpitis. But if it crosses a boundary of minutes, like 60 seconds or more than 1 minute, it will be diagnosed as irreversible pulpitis. On the basis of duration of pain, as I mentioned previously, it is also a factor in the diagnosis of which kind of pulpitis a patient is having or other is having. Okay, so now you applied a hot or cold stimulus to an inflamed pulp, it will get you sharp transient pain and of short duration Okay, so this will be diagnosed as reversible pulpitis. And when you remove those stimulus like hot and cold stimulus from an inflamed pulp and the pain or response is immediately vanished, it will also be diagnosed as reversible pulpitis. So in reversible pulpitis, hot and cold stimulus will cause sharp, transient and short duration pain, and when you remove the stimulus, the pain immediately vanishes away. So this will be your diagnosis of reversible pulpitis. Now we will talk about irreversible pulpitis and its response to pulp vitality test. When you will going to apply hot or cold stimulus to an inflamed pulp, the pain of irreversible pulpitis. Firstly, the pain of irreversible pulpitis will be continuous or intermittent, spontaneous and lingering. Remember these four words: intermittent, continuous, lingering and spontaneous. And pain will last up to minutes to hours. The pain of reversible pulpitis will only last to seconds, as I previously mentioned. Okay, so the pain of irreversible pulpitis will last for minutes to hours. So now, when you are going to apply hot or cold stimulus to an inflamed pulp and the response is immediate, pain is immediate, okay, the sensation will be immediate. So the response will be immediate, but when you remove those stimuluses to an inflamed pulp, the pain will not be relieved, the pain will be prolonged. In contrast, in reversible pulpitis, when you were removing the stimulus, the pain was immediately vanished or relieved, but in irreversible pulpitis, pain will be prolonged. So in irreversible pulpitis, hot and cold stimulus will produce an immediate response, but when you remove these stimuluses, there will be no immediate relief of pain. The pain will always be prolonged. So this was a video about pulpitis and its responses to vitality test. Basically, it's more of a lecture about the diagnosis of pulpitis. I firmly believe that students and doctors should know the diagnosis. Diagnosis is the most critical key in your clinical procedure. If you don't diagnose pathology right, you will not treat it right. Okay, I hope this lecture will be beneficial for all of you. It's kind of a video lecture. If I get time, I will make a lecture with notes too, same on pulpitis and its diagnosis. So thank you, and keep supporting, subscribe to my channel, and if you like the video, if it's helpful, share it and mention me in the comments that if it's helpful or not. Thank you.